We're going to talk about the category data collection or measurements. We're going to talk about intake and output in hydration for our season review. You want to promote hydration for all elderly residents. You want to encourage hydration by offering liquids with every meal. You want to encourage the resident to drink water in between meals. How often should you offer hydration? As often as you are checking on the resident. Encourage hydration. Give sips of liquids when entering or leaving the resident's room or during activities. You want to keep water within reach with a pitcher in a glass or a cup. Only limit hydration when there is a doctor's order for fluid restrictions. You want to always follow the care plan, which is going to tell you directly how to take care of that patient and what they can and what they cannot have as far as their diet. You need to know that 1 cc is equivalent to 1 milliliter. 1 ounce is equal to 30 milliliters. 1 cup is equal to 240 milliliters. A half a cup is equal to 120 milliliters. 1/3 of a cup is equal to 8 liters. You need to know those measurements pretty much by heart to kind of figure out some of the questions that can be presented to you on the state exam. Dehydration is a dangerous loss of body fluid caused by illness, sweating, or inadequate intake. For example, we're going to do a question on intake. Jane drank a half a cup of apple juice, 1/4 a cup of milk, 1/3 cup of water, and 1 cup of orange juice. What is her total intake? So you would basically convert half a cup to 120 milliliters, 1/3 of a cup to 80 milliliters. You would convert 1/4 of a cup to 60 milliliters and 1 cup to 240 milliliters. And then when you add all these things together, you'll get your total intake, which is 500. Here's another question. Jarvis drank a half a cup of orange juice, 1/4 cup of apple juice, and 2 cups of water. How much is the intake in milliliters? You'll go through this same process and you will come up with a total of 660 milliliters for the intake. Here we have two cups. 1 cup has blue fluid in it and the other one has red fluid in it. And the water or the fluid is colored to help you easily guesstimate the amount of fluid that's in the cup. The blue cup is close to full, or it is at 230 milliliters, I would say. And then with half of the fluids being gone in the second cup, which has the red fluid, I would say that would be about 120 milliliters. We do have a skill that you will learn called feeding the dependent resident, where you will have to guesstimate the amount of fluid that is in the cup and the amount of fluid that the resident actually took in. The next slide shows you 3 cups. The blue cup, which we said is about 230, and then the red cup, which is halfway full, it is at about 120, and then the third cup has green fluid in it, which is at about 80 cc's. So that's about 1/3 of a cup. The fluid's in the green cup. And so now we're looking at 4 cups, and we're going to say that the blue cup is at 230 to 240 milliliters. We know that the yellow cup now is at about 120 milliliters. And then the cup with the red solution is at about 80 milliliters, and the cup with the green solution would be at about 60. So you have 1/4 of a cup demonstrated here, and you have 1/3 of a cup demonstrated here. You have a half of a cup that's demonstrated here, and then you have what a full cup looks like. Here we have a graduated cylinder, and you will need to be able to accurately read fluid that has been added to a graduated cylinder. This particular cylinder has yellow fluids inside of it, and it is measuring at 775 milliliters. This is a picture of a 24-hour collection, a urine collection container. As a CNA, you may be asked to start or perform this test on the resident. When you're doing a 24-hour urine procedure or test with a resident, you want to make sure that you are collecting all of the resident's urine for a total of 24 hours. When you begin to take this test, or begin this procedure, the very first time that the resident voids or pees, this amount of urine is discarded. Everything after the first void or after the person has peed for the first time is placed inside of this collection container that's present on your screen. And this collection container must be stored on ice. So most of the time you will see this collection container stored inside of a basin at the patient's bedside that's filled with ice. Um, you will also place a sign on the door to notify other healthcare providers that a 24-hour urine test or procedure is in progress so that they know not to discard any urine during that 24-hour period. This is a urine strainer. It's used to strain urine for residents that have renal calculi or renal stones. Remember, renal calculi is the medical terminology for a kidney stone or a renal stone. And this is a urine strainer. If a person was suspicious of passing a kidney stone, you would strain all of their urine with this strainer in an attempt to catch the stone so that it could be sent to the lab for observation. This is an example of a Foley catheter bag. As a CNA, you may be required to empty the urine from this Foley catheter and measure it in a graduated cylinder, which we've seen a couple of slides before. And you would do this in order to keep accurate output. So you want to name 4 types of scales. So you're going to have your digital scale. You're going to have a stand-up scale. You're going to have a wheelchair scale. And then you also have a scale that's located on the lift. When we're documenting the height, we're documenting the height in measurements of inches. Why is accuracy of the resident's height and weight important? It's important because our pharmacists and our doctors are using these measurements to calculate the appropriate dosages for the resident while they're in the long-term care facility or hospital. 3 reasons why we take the resident's height and weight is the height and weight helps us to understand the healthiness of that patient according to our BMI standards. Our height and our weight is going to help us to determine what type of medications that will be ordered for that resident. And then when it comes to the patient's bed or going to different procedures, the height and weight is going to be important so that we know how to use our equipment safely with regard to weight limits. What 2 members of the healthcare team use the height and weight, and it's going to be our pharmacists. They're using it in order to create specific medications for residents that's based on their height and their weight or based on their weight, and then your physicians are going to be using the height and weight also to calculate dosages for medications to be ordered. If a resident is contracted or unable to walk, how do we obtain their measurements for their height? We simply use a tape measure and we measure that patient from head to toe if they are bedridden and unable to ambulate to the scale. You should weigh the resident at the same time using the same scale in order to maintain accuracy of the weight. When weighing an ambulatory resident prior to having them walk to the scale, the safety measurements that must be in place is the bed must be locked. You need to make sure that that person has on some non-slip socks and that they are able to ambulate with a steady gait. If the person is unsteady on their feet, you might need to be a standby assist or help them ambulate with a gait. What is considered baseline measurements and when should those measurements take place? Baseline measurements are going to occur on admission, and these are the measurements that were first gathered for the resident when they entered into the facility. And then we're able to determine whether their measurements are high or low based on the first set of numbers, solid numbers that we got when a person entered. How often should you weigh a resident with congestive heart failure? Every single day. Every day. And you should report a weight gain of 3 to 5 pounds to the nurse immediately because a patient with congestive heart failure is going to retain fluid and they have difficulty urinating or getting rid of their fluid. And so they have a lot of swelling on their body or a lot of fluid that's held on their body. And when we're weighing the resident, that is a way that we're able to accurately keep up with the amount of fluid that's in this person's body. If the person is fluid overloaded that has congestive heart failure, they could experience shortness of breath or difficulty breathing. They may even experience some chest pain. We usually document our weight in kilograms or in pounds. Name the measurements used to document weights as pounds. And we also can use grams. When weighing an ambulatory resident prior to having them walk to the scale, what safety measures must be in place? That making sure that the bed is locked and making sure that that patient has on those non-slip socks. You want to make sure that that person has a slow and steady gait. If their gait is unsteady, you may want to use a gait belt. Want to stand by and assist that person to the scale. What measurements other than height and weight could you be responsible for as a CNA? And that will be your blood pressure, the pulse rate or the heart rate, your respirations, oxygenation, saturation, and temperature. Let's talk about the blood pressure again. The systolic is going to be the top number. The heart is contracting during that time, and the diastolic is the bottom number. And this occurs when the heart is resting. Systolic blood pressure is pressure exerted when the blood is ejected into the arteries, and your normal systolic blood pressure is going to be 120 or below. Your diastolic blood pressure is pressure blood exerts within the arteries between heartbeats, and your normal diastolic blood pressure is 80 or when the blood pressure is high, this is called hypertension, and when the blood pressure is low, this is called hypotension. Hypotension is the low blood pressure. When the systolic pressure is less than 90, it is considered to be hypotension. Hypertension is persistent elevation of arterial blood pressure. High blood pressure is said to be present. It is often and above 140 over 90. The best time to take your blood pressure is early in the morning before the resident gets out of bed. We're going to talk about resident because this is something that a measurement that you'll have to document. When we're talking about a clear liquid dye, remember that a popsicle is a choice on the state exam as an item that's on a clear liquid dye. A dye for residents that usually have heart problems is going to be, or that have hypertension, is going to be a low sodium dye. This dye is going to be low in salt, and you're going to prevent the resident from adding salt at the table. Any salt that is used should be added when the food is actually cooking. Thicket is used for a resident having difficulty swallowing. The thicker the liquid, the easier for them to swallow. You'll see thicket being used with residents that's had a stroke or any disease process that has compromised their ability to swallow. All liquids are included in a full liquid diet, and this includes popsicles as well. So you can see popsicles on the state exam for a clear liquid diet, and then popsicles are also a part of a full liquid diet as well. Full liquid diets allow the consumption of all clear liquids as well as ice cream, sherbet, pudding, milk, milkshakes, frozen yogurts, custards, and orange juice. Some residents' food have to be chopped and blended to make it easier for them to swallow without choking. And so these are going to be your mechanical soft diets. And even some residents have to have a puree diet. And all of these, when we start chopping and pureeing our food, is to make it easier for the residents. Residents that are expected to have surgery are NPO, which is a diet that is ordered the night before the surgery, which basically means that the resident cannot eat anything by mouth after midnight. So NPO means nothing by mouth. When feeding a blind resident, you always want to use a clock to notify them where the food is on the plate. This helps the blind resident maintain independence when they are feeding themselves. This is a test question. So, in order to let someone that is unable to see to remain independent, you want to tell them the location of their food using that clock. Chicken is at 3 o'clock. That's an example. Charting. Medical records are legal documents. Medical records are legal records that must be documented very carefully. Medical records tell the story of the patient's care. Important parts of their story include what care was given, who was on the healthcare team, and how the patient responded to the care. The goal is for the CNA documents to be complete, accurately, timely, legal, and professional 100% of the time. Documentation must be accurate. All entries in the chart must be correct. You may document only the care you provide. You may not document care provided by your team members. You may not document that you provided care that you did not, or that you saw, heard, or felt things that you did not experience. You should not make judgments about your patient or their family in your chart. You should not do these. Documentation tips. You want to chart in the right chart. You want to write neatly and legibly with blue or black ink. You want to use the ink that's allowed by your facility. You want to provide all significant details. You want to chart all changes of conditions and report to the charge nurse. If checking boxes on a form, you want to make sure that those boxes are accurate. You want to sign and date every entry. You want to use only authorized abbreviations for your facility. And then when you are filing a chart, you want to make sure that the patient's name is on every page that's placed inside the chart. You want to correct any error that you make by drawing a single line through the error and charting your initials and the date. You do not erase, black out, or white out any information in the healthcare industry. Do not document incident report completed. Avoid tattling and finger pointing when you're documenting. Samples of inaccurate documentation. The following are true examples of charting areas noted in CNA flow sheets. A CNA is charting the patient is ambulating when the patient is actually comatose. That's a huge error. Charting that the patient is incontinent when the patient has a Foley catheter in place. Charting that the patient showered and the patient is at the hospital. Patient is turned and repositioned, and the patient has actually expired. Charting that the patient's heels were floated when the patient actually has bilateral amputations. They don't have any legs. So these are examples of errors that you can make when you are charting. So be careful when you're charting in the medication record because it is a legal document.